What is breast cancer? Breast cancer is a type of cancer that starts in the breast. Cancer starts when cells begin to grow out of control. To learn more about how cancers start and spread, see what is cancer. Breast cancer cells usually form a tumor that can often be seen on an X-ray or felt as a lump. Breast cancer occurs almost entirely in women, but men can get breast cancer, too. It's important to understand that most breast lumps are benign and not cancer, malignant. Non-cancerous breast tumors are abnormal growths, but they do not spread outside of the breast. They are not life-threatening, but some types of benign breast lumps can increase a woman's risk of getting breast cancer. Any breast lump or change needs to be checked by a healthcare professional to determine if it is benign or malignant, cancer, and if it might affect your future cancer risk. See non-cancerous breast conditions to learn more. Where breast cancer starts. Breast cancers can start from different parts of the breast. Most breast cancers begin in the ducts that carry milk to the nipple, ductal cancers. Some start in the glands that make breast milk, lobular cancers. There are also other types of breast cancer that are less common like phyllodes tumor and angiosarcoma. A small number of cancers start in other tissues in the breast. These cancers are called sarcomas and lymphomas and are not really thought of as breast cancers. Although many types of breast cancer can cause a lump in the breast, not all do. See breast cancer signs and symptoms to learn what you should watch for and report to a healthcare provider. Many breast cancers are also found on screening mammograms, which can detect cancers at an earlier stage, often before they can be felt, and before symptoms develop. Illustration showing breast anatomy from front and side view / includes the chest wall, muscle, ducts, areola, nipple, lobules, stroma, ribs and lymph nodes. Types of breast cancer. There are many different types of breast cancer and common ones include ductal carcinoma in situ, DCIS, and invasive carcinoma. Others, like phyllodes tumors and angiosarcoma are less common. Once a biopsy is done, breast cancer cells are tested for proteins called estrogen receptors, progesterone receptors, and HER2. The tumor cells are also closely looked at in the lab to find out what grade it is. The specific proteins found and the tumor grade can help decide treatment options. To learn more about specific types of breast cancer and tests done on the breast cancer cells, see Understanding a breast cancer diagnosis. How breast cancer spreads. Breast cancer can spread when the cancer cells get into the blood or lymph system and are carried to other parts of the body. The lymph system is a network of lymph, or lymphatic, vessels found throughout the body that connects lymph nodes, small bean-shaped collections of immune system cells. The clear fluid inside the lymph vessels, called lymph, contains tissue byproducts and waste material, as well as immune system cells. The lymph vessels carry lymph fluid away from the breast. In the case of breast cancer, cancer cells can enter those lymph vessels and start to grow in lymph nodes. Most of the lymph vessels of the breast drain into lymph nodes under the arm, axillary nodes. Lymph nodes around the collarbone, supraclavicular above the collarbone and infraclavicular below the collarbone lymph nodes. Lymph nodes inside the chest near the breastbone, internal mammary lymph nodes. Illustration showing the supraclavicular, infraclavicular, axillary and internal mammary lymph nodes in relation to the breast. If cancer cells have spread to your lymph nodes, there is a higher chance that the cells could have traveled through the lymph system and spread, metastasized, to other parts of your body. The more lymph nodes with breast cancer cells, the more likely it is that the cancer may be found in other organs. Because of this, finding cancer in one or more lymph nodes often affects your treatment plan. Usually, you will need surgery to remove one or more lymph nodes to know whether the cancer has spread. Still, not all women with cancer cells in their lymph nodes develop metastases, and some women with no cancer cells in their lymph nodes develop metastases later. Types of breast cancer. There are many types of breast cancer, and many different ways to describe them. It's easy to get confused over a breast cancer diagnosis. The type of breast cancer is determined by the specific cells in the breast that are affected. Most breast cancers are carcinomas, which are tumors that start in the epithelial cells that line organs and tissues throughout the body. When carcinomas form in the breast, they are usually a more specific type called adenocarcinoma, which starts in cells in the ducts, the milk ducts, or the lobules, milk-producing glands. In situ versus invasive breast cancers. The type of breast cancer can also refer to whether the cancer has spread or not. In situ breast cancer, ductal carcinoma in situ or DCIS, is a cancer that starts in a milk duct and has not grown into the rest of the breast tissue. The term invasive, or infiltrating, breast cancer is used to describe any type of breast cancer that has spread, invaded, into the surrounding breast tissue. Ductal carcinoma in situ, DCIS. Ductal carcinoma in situ, DCIS, also known as intraductal carcinoma, is a non-invasive or pre-invasive breast cancer. Invasive breast cancer, ILC or IDC. Invasive, or infiltrating, breast cancer has spread into surrounding breast tissue. The most common types are invasive ductal carcinoma and invasive lobular carcinoma. Invasive ductal carcinoma makes up about 70 to 80% of all breast cancers. Special types of invasive breast cancers. Some invasive breast cancers have special features or develop in different ways that affect their treatment and outlook. These cancers are less common but can be more serious than other types of breast cancer. Triple-negative breast cancer. Triple-negative breast cancer is an aggressive type of invasive breast cancer that accounts for about 15% of all breast cancers. It is a difficult cancer to treat. Inflammatory breast cancer. Inflammatory breast cancer is an uncommon type of invasive breast cancer. It accounts for about 1% to 5% of all breast cancers. Less common types of breast cancer. There are other types of breast cancers that affect other types of cells in the breast. These cancers are much less common, and sometimes need different types of treatment. Paget disease of the breast. Paget disease of the breast starts in the breast ducts and spreads to the skin of the nipple and then to the areola, the dark circle around the nipple. It is rare, accounting for only about 1 to 3% of all cases of breast cancer. Phyllodes tumor. Phyllodes tumors are rare breast tumors. They develop in the connective tissue, stroma, of the breast, in contrast to carcinomas, which develop in the ducts or lobules. Most are benign, but there are others that are malignant, cancer.